Unit 50 Neuro questions 2. 60. A nurse is performing a neurological assessment on a client and is assessing the function of cranial nerves. 3, 4 and 6. Assessment which items by the nurse yield best information of these cranial nerves. 1. Response to verbal stimuli. 2. Insight, judgment and planning. 3. Affect, feeling or emotion. 4. Eye movement. The correct answer is 4. Eye movement. 61. A client is in the emergency room is diagnosed with Bell's palsy. The nurse assessing this client expects to know which of the following. 1. Narrowing of the palpebral fissure. 2. A leg in closing the bottom eyelid. 3. Asymmetrical smile. 4. Paroxysmal of expressing the pain in the lips and cheek. The correct answer is 2. A leg closing the bottom eyelid. 62. A nurse has instructed a client with myasthenia gravis about ways the managed health at home. The nurse would evaluate that the client needs more information if the client made which of the following statement. 1. I should take my medication an hour before mealtime. 2. I have made arrangement to get portable resection bag and home suggestion equipment. 3. Going to the beach will be a nice relaxing from activity. 4. Here's the Medi-Alert bracelet I obtained. The correct answer is 3. Going to the beach will be a nice relaxing from the activity. 63. A nurse is reviewing the record of the client is admitted to the nursing unit. With a diagnosis of thrombotic cerebrovascular accident, the nurse is reviewing the assessment data and would expect to note which of the following documented in the record. 1. That the client experienced paresthesias and few days prior admission to the hospital. 2. That the client complained of severe headache and suddenly developed paralysis. 3. The sudden loss of consciousness occurred. 4. That signs and symptoms occurred suddenly. The correct answer is 1. That the client experienced paresthesias for few days before the admission to the hospital. 64. A nurse is assessing the client with Guillain-Barré syndrome. The nurse determines that which of the findings would be greatest concern. 1. A blood pressure decreased from 106/60 mmHg to 98/58 mmHg. 2. Respiratory vital capacity of 10 ml per kg. 3. Difficulty articulating words. 4. Paralysis progressing from the toes to waist. The correct answer is 2. Respiratory vital capacity of 10 ml per kg. 65. A client with Parkinson's disease has during diagnosis of risk for fall related to an abnormal gait documented in the nursing care plan. The nurse asks the client expecting to observe which type of gait. 1. Broad-based and bending. 2. Accelerating with walking toys. 3. Unsteady and staggering. 4. Shuffling and propulsive. The correct answer is 4. Shuffling and propulsive. 66. A client with a diagnosis of Parkinson's disease began taking symmetrical approximately 2 weeks ago. The client responds to the client for a follow-up evaluation. The nurse would determine that the client is experiencing an adverse reaction related to the use of this medication is which of the following noted. 1. Decreased akathisia. 2. Client complaints of urinary retention. 3. Decreased rigidity. 4. A blood pressure of 136/84 mmHg. The correct answer is 2. A client complains of urinary retention.